Assalamu alaikum and welcome back to another video. Here I'll show class 3 preparation, cavity preparation for preclinical students. This figure demonstrates the dimensions I'll be following for this preparation. The left image demonstrates incisal, gingival and mesodistal dimensions, while the side view image on the right shows the depth, which is around 1.5 to 2 millimeters. The class 3 caries is typically below the contact area. So here I'm marking the prep starting gingival to the contact area and work extending around 2 to 3 millimeters. And the width is around 1 to 1.5 millimeters. In general, when you mark the prep, it's better to keep the dimensions smaller than the expected final preparation, just to have some room for any adjustments at the end. And just like I did in the previous video, it's good to take note of the length of the 330 burr to help you estimate the cavity depth while preparing. And before drilling, it is crucial to orient the handpiece correctly. It must be vertical to the palatal surface of the tooth when looked at from the side view or proximal view. The handpiece must also be vertical when looked at from the incisal view and not tip too much towards the mesial or distal. Before starting the prep, the adjacent tooth must be protected. One method is to place a wedge to provide some separation and therefore reducing the likelihood for adjacent tooth injury. We're using products like a wedge guard that has a metal piece as an additional protection. In both cases, these techniques are not a guarantee to protect the adjacent tooth, so please keep that in mind. At the center of the marking you have drawn, establish the initial depth. Don't advance the burr to full depth yet. Rather, go 1 to 1.2 millimeters to give yourself room to adjust at the end when finishing the cavity. And that's to obtain an accurate depth. It's establishing the initial depth. You can now extend the cavity outline incisally and gingivally. From time to time, you can stop and take measurements, depth, width, the length of the cavity, and so on. One important note here, keep the burr rotation direction in mind to avoid injuring the adjacent tooth. For example, the burr will slip to gingival embrasure if I move the handpiece from distal to mesial at the gingival wall of the preparation. Rather, move it the opposite direction to avoid any injury. Here I'm trying to define the internal line angles. I'm barely touching the floor as the depth has been established already. So I'm just applying slight minor pressure on the walls as I'm moving the burr throughout the prep. You see the enamel lip there? It's hard to remove it with the burr without injuring the adjacent tooth. So it's probably a good idea to use a hand instrument like an enamel hatchet. Remember, when using the enamel hatchet, the lower end of the bevel is the cutting side. Here I'm removing that enamel lip little by little as you can see, from the palatal wall all the way down to the depth of the cavity. Now, as you can see, the enamel lip has been removed and the incisal wall is flat. Check measurements again and confirm that you have the right dimensions. Additionally, check the wall orientation. Remember that the walls have to be parallel to each other or slightly convergent, and they should not be divergent. Don't forget to check the smoothness using an explorer. That's the end of the video. I hope that it was helpful, and thank you very much for watching.